Well, welcome to this Impact for Children webinar on a cold and windy night in London. So wherever you are, I hope the weather's a bit better. The focus tonight is on developing morale and resilience, and that's going to focus on the workforce and indeed with families. So just to introduce myself, my name is Terry McCarthy. I created Impact for Children just about 2.5 years ago now. It seemed to me that after many years in safeguarding practice as a manager, that we needed a much more focused approach to safeguarding. And the subject tonight, which will be dealing with the pressures on social workers, I think demonstrates the need for us to be much more focused and purposeful in how we work with families to get best results. The Impact for Children website, which is up on the screen at the moment, well worth a visit. Lots of webinars and free downloadable material. Some of them I'll be referring to this evening. And here's my contact details if you'd like to chat to me. Okay, so let's get started. The focus of the session this evening is we're going to be looking at the pressures that are on practitioners and managers. We're going to be focusing on how these pressures can overwhelm and lead to low morale and poor practice. We're going to be studying certain aspects of the complexity of safeguarding practice, and we're going to be looking at the need for practitioners and managers to professionally develop. And we're going to be looking at how we can build the skill, confidence and pride of professionals and families. So first of all, let's look at the pressures. The Ofsted published the first year of the new framework last month. So that was the year from November 2013 to November 2014. 73% of children's services judged in that period were considered to either require improvement or as inadequate. So that left about 27 who were considered to be good. So clearly there's a lot of pressure from Ofsted in terms of the quality of safeguarding services. Over many years now we've seen increased referrals, increased number of looked after children, increased numbers of children subject to child protection plans, increased legal proceedings, increased Section 47 assessments. And we have seen a rise in the poverty across the country. This is confirmed by the Institute of Fiscal Studies that considered 600,000 children to be living in poverty across the UK. There's also an increasing number of displaced families within the EU, and recently we've seen, for example, the difficulties in Syria. Syria has led to a number of families coming to Britain, and these are families that are displaced in experiencing massive disruption in their lives, and clearly out of that will come considerable social needs. There's a higher expectation of elected councillors, of service users, of the public, of the media, of our own managers and our own organisations. And I believe the complexity of cases is on the increase. There seems to be an increasing instance of domestic violence, substance abuse, mental health issues that are untreated, and exploitation. To some degree, the rise in poverty, there is various research that suggests that as poverty levels rise, this does have an impact and an increase on issues to do with substance abuse, mental health difficulties, domestic violence and so forth, and criminality. So, and there's tighter timescales and tighter expectations from courts. So all this adds up to a significant increase in the pressure on social workers and their managers. Alongside that, we have seen a decrease in resources. The austerity measures that have been with us for a number of years, it's estimated that in the period of the current government there will be a 43% reduction. About 50% of local authority funding currently is spent on children's social care, about 70% in social care in total, and about 50% in schools and safeguarding services. So that it's become a massive part of local authority expenditure, but around that there has been continuous reduction in services. Partner agencies are focusing more on their core business. For health professionals, that is the diagnosis and treatment of illness. With police, it's the detection of crime and prosecution of suspected criminals. And safeguarding, while still being committed to by those professionals, has become harder and harder to get professionals to fully engage in the safeguarding role. I think they're further and further stretched in more and more directions. There's continuing difficulties in recruitment and retention of staff, and this has led to a lack of continuity support for families. And an aspect that has been identified by the Ofsted report last month, which saw a lack of continuity of service, a lot of disruption to service due to the handover changes of social workers, which in turn was due to recruitment and retention difficulties and a high reliance on interim managers and practitioners. There's been a reduction in managerial support and administrative support, and generally speaking there's been a reduction across many areas, including family support, domestic violence services, voluntary services, youth services have all been hit quite heavily by austerity measures. So what impact has this increased pressure and reduced resources got on the average professional? Well, caseloads are greater, there's a greater amount of unallocated work. There's been an increased focus on the high end of cases within safeguarding and looked after children context. And for many staff there is a general feeling of being overwhelmed, out of control, unable to deal with the change and the challenges in front of them. And we'll talk a lot more about that shortly. High levels of fear, anxiety and stress, high levels of sickness, turnover, and as we've already mentioned, vacancies, long working hours, working through lunch breaks, working when sick, increased dissatisfaction from partner agencies and families, more complaints, and generally speaking a greater element where people are just generally dissatisfied. So this is some of the impact. A recent professional social work survey, that's BASWA, last month found that 1 in 10 social workers were considering leaving social work. The current career length of the average social worker is 8 years. That's about half what it is for nursing, for instance. And the survey from PSW confirmed that 23%, so almost a half, felt that the pressures of work were affecting their health. So these are recent clear messages of the impact of the stress on workers. So let's look a bit further in that. Well, we already covered this one. And the shortening of career, as we say here, does lead to further retention difficulties and recruitment difficulties, which in turn leads to greater pressure. So there's a vicious circle going on here. The pressure has a tendency to make practitioners do what they're directed to do. So we're much more led by performance indicator, what's being measured, the tasks and the procedures that are spelt out by managers. So this can lead to much more process-driven practice. It's often said what gets measured gets done. This is something that Monroe quoted. And when under pressure, if you have a set of performance indicators, the tendency is to make sure that you've ticked the boxes so that a visit has been done, an assessment has been completed in time, timescale for court's been done, supervision has taken place, and so forth. Core groups have taken place, for instance. However, with less attention to the quality of those. So this is one of the human responses to pressure. We become much more patterned. We follow much more patterned behaviour. And we give less consideration to the quality of what we're doing. And there's a certain security that comes from following direction and meeting clearly measured indicators. So there is a sense of when under pressure, there's a security to that. And whilst many workers will complain about the amount of bureaucracy and the amount of recording that's to be done, in many ways, in an unpredictable and unsafe world, sitting and recording at a PC can feel much more safe and secure. There's going to be a much lower level of reflectiveness, creativity. One of the things we with any learning and with any reflective practice and any creative practice, it involves thinking outside the box. It involves coming up with new ideas, trying to explore new approaches. And that always carries a risk, because with that comes a greater chance of making a mistake, making an error, getting it wrong. And many practitioners feel under threats that if they were to do that, that would be taken quite dimly by their managers. And therefore the tendency is to stick to the tried and tested paths. And therefore creative, flexible, reflective thinking can often be a casualty. The engagement with families, which again is a highly qualitative aspect, and the work with children directly, again requires a lot of time, a lot of energy, a lot of tenacity, a lot of ingenuity. These kind of engagements are often neglected. And it is common for practitioners to kind of tick the boxes. I've seen the child, I've done the visit, I did the visit on time, it's within 6 weeks, rather than really thinking about how that visit has really engaged with the families and really moved on the safeguarding agenda with that family. There's generally less energy to address the complexities of the work, and this is something we're going to focus on in this session further. So out of all of this, the impact of the pressure can make people very process driven. It can lead to a lack of clear focus for progress. It can lead to a lot of hours being spent with families, but perhaps not with any real tangible benefit in terms of the desired outcomes. I've chaired many meetings where over a period of many months and sometimes years, there is little evidence of any real progress in terms of the risks to a child and the fundamental issues that are causing children to be harmed. Yet thousands, sometimes hundreds and sometimes maybe thousands of hours has been spent across the agencies. So this is clearly at a time of low resources and limited resources, we really have to start thinking about these issues. And just remind yourself that what is generally considered to be best practice. This is the messages that are coming out of the Ofsted, the messages that Eileen Munro in her report on child protection a couple of years ago has highlighted. These I'll put them all up together. Oops, so there we go. Good intervention, early intervention, good relations with families, as we've already seen, and partner agencies. Clarity about what the child is saying, the child's experience, their views, their experiences. Probing, exploring, open-mindedness, good professional judgment, using evidence, analytical, creative thinking, understanding the principles, and being outcome focused. These are all the things we've talked about. These all to achieve all of this requires considerable amount of energy, and when under pressure, we think we have to face up to the risk that many of these valid objectives of practice can be compromised. So let's look at how we can develop morale and resilience. And first of all, we're going to focus on the workforce. So what staff are saying is that they want, and this is coming out of a number of surveys that have been published over recent years, they're saying first of all, they want reasonable caseloads. Many practitioners have got caseloads well in excess of the recommended 15 children for practitioners who have been qualified and practiced for over a year. They want a better work-life balance. As we've already seen, practitioners and managers are feeling that the work is affecting their personal life, their health, their family life. They want clearer focus of purpose, and that's something we'll focus on tonight. Pay and conditions is there, but to be honest, in most surveys, increases in pays and conditions of work is not at the top of practitioners and managers' list. They tend to be more focused on the work environment and the direction and the environment in which they're working, and how they're enabled and supported to focus and develop their practice. These are more important issues. It's not to say that greater pay and conditions will help, but I think authorities that have focused on offering extra rounds of money that has not necessarily been evidence to really increase the morale of the workforce or indeed recruitment and retention over an extended period of time. It may have some short wins, but the long-term gains are highly questionable. They want opportunities to reflect and develop their practice. They want to spend more time with families. They want to be coping with the demand, less bureaucracy and duplication, and better access to services and tools. And finally, they're wanting to feel as though they're professionally developing. So these are the issues that really seem to tap into the morale, trying to get workers to feel as though they can carry on doing the job. They have the resilience and the tenacity to carry on doing what is clearly a very, very difficult task. Now, what I want us to focus now on a little bit more on the directive style of management and the performance indicator style of management. It is common that in order to develop practice, the most common approach to that is probably for managers to be very clear about what they expect of practitioners, what performance targets are expected, often leading to protocols, guidance, standards, procedures, best practice guides being published and circulated to staff, often with workshops or sessions to highlight these for staff. And then these are monitored through performance systems, audit, supervision and management vigilance. And then non-compliance is addressed through that. And this approach seems to presume that if workers are clearer about what they're trying to do and compliant with what they're trying to do, then practice will increase. I'm going to argue this evening, as I've done many times now, that this will only lead to very limited progress and benefit to the quality of work. It is likely that that workers do know what they need to do, and they know why they need to do it. What often gets in the way is how they're going to achieve this, particularly in the limited time they have and how they're meant to focus their time to get the best outcome for children. I feel we must understand and work with the complexity of safeguarding, the messiness of safeguarding, and use this to build a more qualitative approach where we support practitioners to understand the levels of complexity and how they can develop this and get beyond it in order to make real differences for children, and have a coherent approach where there's a clear purpose, a clear focus, which joins up what practitioners are doing when they're visiting, what managers are doing in supervision discussion, how core groups are organised, how people plan for conferences, how assessments are completed, the short-term and long-term planning cases, recording, decision-making. All these things need to be together in a congruent, in a cohesive approach, all focusing around what we're really trying to do with the family. So we covered this subject in the last webinar, the one last week. But let's just roll over it again reasonably quickly. I argued in more detail last week that social work, safeguarding work, is very complex by nature. It is not a crisis problem. It is not a straightforward problem. It involves many aspects, often very entrenched problems, elements combining together to create quite complex and complicated situations. Situation constantly shifting, changing, being redefined, information being emerging as we go along. High levels of anxiety and fear, which are leading to inaccuracies and distortions, some concealing of information, people feeling defensive of their position, and that can lead to misinformation. So all of that leads to quite a complex situation with families, and social workers and their managers have to struggle with understanding that complexity and making sense of it. And here are some of the skills required of practitioners. I won't go through them, but they're there really to pause the program if you're watching it as a recording and really just try to digest these lists. It's quite a list of skills, and personality traits that we're really expecting practitioners to have. And we cannot underestimate the challenge that we're placing in front of practitioners and the challenge we're placing in front of managers to oversee and support that practice. So let's have a look at a few of the complexities in a little bit more detail. I've singled out about 5 or 6 here. If you go onto the website, there is a document called the Emotional Challenges, Dilemmas and Conflicts in Safeguarding, and that lists 20 dilemmas and conflicts and challenges. But we're going to single out a few here to get a taste of what these are. Practitioners need to balance have to be clear about the reasons for why a child has been mistreated and what has leading to risks to the child, while still finding ways of addressing these. So there's a balancing act between looking backwards at what has happened and looking forward at how we can address and fix that. Some of those solutions are in a context of very entrenched problems. Many parents, most parents, probably almost all parents that we're working with, their problems relate to alcohol or substance misuse, untreated mental health problems, learning disability, domestic violence, criminality, emotional difficulties, attitude to children. These are violent tendencies. These are highly entrenched behaviours that we're trying to shift. And finding solutions to that is very, very challenging. We have to offer challenge to families, be very straight talking while still holding the relationship and building rapport. This is asking a lot. A diplomacy of Henry Kissinger. We need to find the time to listen to children and families, and this takes time. So if we're going to engage with a child, for instance, which is a theme that's often come up in many Ofsted reports, and Monroe raised it in her report, and many others have raised it, the need to sit down and engage and understand a child's experience, understand the voice of the child. But that will take at least several sessions to build the trust and the rapport. And you can't rush these things. You have to spend maybe the first session or two just building the trust, and then you can start to talk to the child about relatively easy things for them to talk about, leading on to much more difficult to broach subjects. So this takes time. It takes time both in terms of hours and time over a number of, perhaps over a month, to start to build that relationship. And similarly with parents that are quite defended or worried or anxious about the intervention, to gain their trust, parents' trust, siblings' trust, takes time. Finding that in a highly pressured work environment is a challenge. We need to balance probability. In many cases, we're not living in a world of certainty or beyond reasonable doubt. We're living in a balance of what is more likely to be true than not true, what is over 50% likely, the probability, the balance of probability. This leads that even when there's a clear balance in favour of believing a child was harmed by a parent, there's still maybe a reasonable element of uncertainty around that, and that can lead to many challenges. We need to be balancing the needs of families with the expectation of partner agencies, and balancing parental and child's needs. As we've already seen, the primary reason, the fundamental reason why children are harmed is often to do with parental choices, carer choices, and lifestyle choices. And this is what needs to be addressed and fundamentally shifted. So while we have to be child-centered, our focus really has to be on shifting those fundamental problems, what I call the root problems. And finally, we need to meet timescales while still being sensitive to a pace of change. These are, as we said, entrenched problems. So we need to be meeting reasonable timescales and meeting the timescales of the child. But we need to be sensitive to the fact that things don't change instantly, and lifelong issues and choices take time to shift. So in order to work with that, we need a real mix of different types of approaches with practitioners. Now, formal supervision is the cornerstone of managerial vigilance, but as I'm often saying, with 1.5 hours supervision every 4 weeks and an average caseload of 15 children, or recommended caseload of 15 children, most practitioners, there's do the maths, but it's about 6 minutes a month per child. So clearly formal supervision isn't really going to offer the opportunity for in-depth discussion. Informal supervision takes up a lot more team manager time. Guidance and training, particularly looking at how you can address issues, is really, really important. And I think coaching approach, this is about having a much more qualitative discussion time with practitioners and managers about how you can shift and engage with families. This can be done as case consultation. And we can use audits and case monitoring to really start to look at what's working, how can we improve our intervention with families. And in this mix of ways, we can start to understand what children and families are needing, and why a child is being harmed or is at risk of being harmed, and how we can shift attitudes and find the motivation across partner agencies, across families, to start to shift some of this. It's not easy, and it's not going to happen. It's only going to happen with practitioners and managers being fully supported. If you leave a practitioner on their own to go out in the rain to see families and children, they're less likely to really get underneath these issues. So we need a lot of support, perhaps partner agencies working together, perhaps colleagues going out with each other, perhaps senior practitioners going out with practitioners, perhaps two practitioners going out together and jointly working a case. This is, whilst resource intensive, maybe what's required to shift at least some families. This joint working. So let's talk a little bit about developing the morale and resilience of families. We have to start developing our relationship with families to be much more direct and clear. There's a document called Ensuring Clarity of Involvement of Families, which is a free download from impactwithchildren.com, which goes through 13 steps, there's a document that goes through 13 steps to working with families, and there's another document also called Ensuring Quality of Involvement, which looks at how we can be very, very direct and straightforward with families about what's expected of them. And there's a suggested draft of a letter that can be sent to families, which can spell out what they can expect of a social worker, what the social worker would be expecting of the family. I'm trying to get this really put on the table, cards on the table, if you like. The root problem, I've referred to it earlier, is the fundamental problem. This is the root reason why a child is mistreated, and this is very limited number. It's alcohol, substance misuse, violent tendencies, domestic violence, untreated mental health problems, violent criminal tendencies, emotional difficulties, learning disability. These kind of issues relating to carers are really the root problems. These are things we need to be supporting parents better, motivating them to change where appropriate, where necessary, to move things on. Continuously monitoring the risks and the change in circumstances. I've talked before about thinking more about assessing and planning as a continuous process, rather than thinking about an assessment that is completed on a particular date, dated, signed and copied. That it's a continuous process of reconsidering and reconsidering again what a child is going on and what's going on within the family. We need a higher expectation of change within reasonable timescales, and be much more courageous about when legal intervention needs to be considered. Within the first 6 months of a child, for example, being subject to CP plan, if there isn't real shift within the family in that 6 months, the first 3 to 6 months, it's unlikely to happen in the next 6 months. That first 3 to 6 months is the most intensive period for a family's life, and if they're not shifting during that, you really have to ask the question, what do we need to do differently to gain a motivate change? We have to focus on the problem and the solution, and this is something we're getting a bit better at in terms of looking backwards at what the problem is. This is the accountability aspect of why a child has been harmed, but also looking forward in a more positive way at individuals' responsibility for making things better. So we've got to be looking backwards and forwards on all cases, and the tendency is we often over-focus on the problem, and that can alienate and demoralize families. By moving forward into a solution focus, while still acknowledging what has happened, but by also balancing that with moving forward, we can create a lot more energy and motivation, and that's very important for achieving real change. And we need to be using focus groups, focusing on core groups, legal planning meetings, conferences, etc., to really start to be clear about that. If there's one of the most important reasons for working with children, in addition to bringing their views, experience into the assessment and the understanding of what's going on, is that it also offers us a real good acid test as to whether things are getting better. That by talking to the child, if a child is happier, telling us that things are going better at home, that they're getting to school on time, they've got clean clothes, the bed is a more comfortable one to sleep in, this can give us a real hard idea, really good idea as to that something fundamentally has changed within the family. And this is a qualitative performance management we need to be thinking about. So I'm going to finish this section with just highlighting, we talked about this at the last webinar, but I think it's worth opening it up again. 4 key questions, which I'm calling WIPE, because the WIPE is one way we can try to remember these. And these are 4 questions that if we just do these 4 questions, I think we can significantly improve our focus on our purposefulness of intervention and increase the motivation of families and multi-agency working. First question is being clear about why the child is being harmed. So this is looking at what is the fundamental reason. What is going on? Is it about alcohol? Is it about a mental health problem that hasn't been properly treated? Is it about a learning disability with a parent that hasn't been properly supported? Is it about a mother having violent partners? That, you know, why is a child being harmed? What is at the fundamental root of that? That's question number 1, W, why. The second question is, what impact does that have on the child? So this is taking it a step further. If there's domestic violence in the home, we know that's going to have an impact on children. All the research has told us that. But being able to make that a much more individual statement relating to particular children, this is incredibly useful, both in understanding the risks to the children, but also motivating adults to change, because there's nothing quite like being exposed to a child's views to really help a parent understand the severity of the situation and the need to address that. So that's the I for impact. That's the W and that's the I. The P is we've got to have a workable plan to address the root problems and the risk factors. That's the P for plan. And the E is there's got to be evidence of progress. Having all the planning in the world is not going to make any real difference if there isn't real evidence of change. This final question, this final evidence of progress is absolutely crucial and is the proof of the pudding. And then finally, we're just going to, in the sake of the fullness, is just to start looking at some of the culture we need to be developing in order to develop staff and develop our relationship with families. We need to be developing leadership and managerial style that blends these two together. So it's both clear expectation, which is very much to do with the management style, clarity of purpose, and there's also a lot of enabling the leadership style, enabling individuals to learn, develop, understand, overcome barriers, overcome difficulties, understand the complexity of the situation. We need to be promoting relationships that are respectful, empathetic, enabling, clear expectation and constructive use of our authority. So that's used in a positive way. And we need to be recognizing that these relationships exist between managers, with families, between parents and children. And we need to be echoing this across the whole of the environment. And we need to be ensuring that there's a learning environment that motivates to ensure best outcomes. So people need to be growing and developing. And that goes for staff and goes for families. An environment that looks at qualitative issues and quantitative. Look at both of these. We need some quantitative indicators, and it is important that visits take place, that assessments are done within a reasonable timescale, that court dates are met and so forth. These are quantitative indicators, and these got to be judged and measured and monitored. But we also need the qualitative measures, the how in a more, it's, if you like, in a less easily defined way, a more messy way, but where's our qualitative information to believe that things are changing and things are working. Okay, so just run through some of the summary here. There's a demanding time for social workers, high pressures. We need to find new ways to practice. So families must be assisted to develop skills and resilience, and we must rethink our working culture. These are some of the key things coming out of tonight's session. Okay, so any further information, there's my contact details. And let's open up here. That the next one is about making a real difference to outcomes for children. So this is going to be focusing more on some of the aspects we've talked about tonight, key aspects of learning, balancing risk with finding solutions, the role of supervision, developing clarity with families, and working with children to incorporate their experience and views and how we can do that better. The joining instructions, you'll find them on the bulletin board on the Impact for Children website with the link to go to meetings. And that'll be available as a recording, should be on the website by probably next Friday. And tonight's webinar should be up there by tomorrow, or at least if it's not actually on the website, there will certainly be a link on the bulletin board that tells you where you can click to find it on YouTube. Okay, well, once again, many thanks for joining the webinar tonight, and have a lovely evening. Thank you. Goodbye.